Probably already know me. My name is Arelis Cortez, and I am the event coordinator at Turning Point. Thank you so much for being here. Today's lecture is being sponsored by Crooked Creek Think Pink Golf Tournament. It's a fundraiser for Turning Point, and it's happening October 11th. You can find out more about that on our website, myturningpoint.org. But since we started a few minutes late, we'll go ahead and let Carrie take over.
Hi, thank you guys all for coming. So I am Carrie Kozel, one of the physical therapists at Turning Point. And so this is the part 2 of our series of the steps to minimize the risk of breast cancer recurrence. And so if you were able to attend our last one, the part 1 series of this about nutrition, welcome to our second part. If you are interested and you missed it, like Arelis said, they are recorded, so you can certainly go back and look at those if you are interested. So I'm going to go ahead and get started. So I put up this little cartoon because I think it's funny that if you ask anybody, is exercise good for you? The vast majority of the world will tell you that yes, exercise is good for you, but there's certainly a disconnect for us about knowing that it's good for us and then actually exercising. And so I think in our culture, we really want the quick fix, right? So we want the medication. We want to be handed something that will immediately make things easier and fix things without us having to do too much effort. So if you don't already know all of the wonderful benefits of exercise, I am going to fill you in on those. So exercise in general is going to help us to control or lose weight. It helps to improve our energy level and our stamina, and that's just general energy level, but also cancer-related fatigue, which is a more pervasive, persistent fatigue that occurs as a result of the cancer itself in addition to the treatments. And so some of you may be experiencing that now or have experienced that in the past, and exercise helps to improve that. It also will decrease our LDLs. Those are our bad cholesterols. It'll decrease our triglyceride levels. And it also increases our HDLs. So those are those good cholesterols. It decreases the risk of cardiovascular disease. So those are things like coronary artery disease, heart attack, strokes related to the plaque formation of coronary artery disease. It helps to lower our blood pressure. It helps to decrease blood glucose. So this is just the amount of sugar that's in our blood. In addition to decreasing our blood sugar, it also improves insulin's ability to function. So what that means is it allows our insulin, which is what takes that sugar out of our blood, turns it into energy and gets it to our cells. It allows that process to happen more efficiently. And as a result of those two things, we end up being able to reduce the risk of type 2 diabetes. It also helps to reduce depression and anxiety symptoms in people with depression and anxiety. Interestingly, it also helps to reduce the risk of developing depression in the first place, which I think is particularly important right now that we are in a pandemic. It also helps to improve our overall stress levels. So this is just general stress, separate of a true anxiety disorder or depression-related symptoms. It helps to improve our body's antioxidant production. So antioxidants, what they do is they help to improve our body's ability to repair DNA. And so you may have heard eat a lot of blueberries, or you may supplement with a vitamin C or a vitamin E. All of those are antioxidants, but our body actually naturally produces those, and exercise helps to increase that production. Exercise helps reduce pain level regardless of the cause and improve our ability to tolerate pain. It improves our memory, and it also has been shown to have a protective effect for aging brains. So as we get older, our brain functioning is not as efficient. We forget things a little easier, and exercise actually helps to reduce those things and help to protect us against dementia. It improves sleep. It increases sex drive and improves sexual function and performance. This is particularly important for our patients who are postmenopausal and already experiencing that. And in addition then are taking a hormone blocking medication, or for our patients who are premenopausal and taking a hormone blocking medication, or who have undergone chemotherapy and are experiencing chemopause. Exercise improves our immune function in general. It helps maintain muscle mass. The important part of this is fat cells are lazy and they just don't take as much energy to keep them alive compared to muscle cells. Okay, so if you have a pound of muscle, it's going to take more energy just to keep it alive than a pound of fat cells. And so what that means is you can eat the same amount if more of you is muscle and not gain weight, because that muscle has to burn that energy to stay alive just at baseline. Exercise improves our physical function, so our ability to do everyday things. It increases our bone density. Again, this is really important for our patients who are on those hormone blocking medications and are also postmenopausal, because all of those things deplete our bone density. It improves balance. This is important as we age, but it's also important for our patients who experience side effects of chemo that cause neuropathy. And ultimately, that also helps to reduce our risk of falls. Interestingly, exercise in general keeps you alive longer. So that is an all-cause mortality. If you look at all causes of death, if you exercise, you're less likely to die as soon as other people, okay? And the reason we're all here is to talk about exercise's benefit for specifically cancer. So cancer occurrence and recurrence. So on this little chart that's from the CDC, this just shows all of the types of cancer that have been shown that if you exercise, it reduces your risk of an initial diagnosis of these cancers. So if you didn't get it before, I hope you get it now, all of the huge benefits that exist for exercise. So we're going to kind of dive into our main focus of today, though, about reducing recurrence rates for breast cancer. So before we get to what exercise can do for you, what I want to talk about is where are we at right now? So what is our recurrence risk? So if we look at local recurrence rates, and that's if that cancer comes back in the breast itself, in the chest wall, in nearby lymph nodes, okay? So that's what we consider a local recurrence. So we've broken down into sort of generally speaking, based on your surgical intervention and whether or not you had radiation. So if you've had a lumpectomy and radiation, a local recurrence over 10 years, post-diagnosis is 3 to 15%. If you've had a mastectomy and no lymph node involvement, so you didn't have any positive lymph nodes, the local recurrence is 6%. If you've had a mastectomy and radiation, and that radiation is typically because there is then lymph node involvement, so you've had that radiation as well, that will drop your recurrence rate to that 6% as well. If you skip the radiation, but you do have positive lymph nodes, the recurrence rate then is about 23%. So I'm going to add to this my little disclaimer in pink. This is a wildly oversimplified description of recurrence rate because I don't know anything about your type of cancer. All we've talked about here is just the surgery and radiation, yes or no, okay? So what also really heavily plays into this is hormone receptor status. Does your cancer grow because of estrogen and progesterone? How large was the cancer? Did you need chemotherapy before surgery because it was a larger cancer size or a tumor size? HER2 status, okay, so that's the protein that generally makes the cancer a bit more aggressive. So was that positive or negative? Did you have that protein there? Triple negative status, meaning you're negative for the hormone receptors as well as the HER2 receptors. What's your proliferation rate? So that's how fast is that cancer cell growing and replicating, okay? So all of those really heavily play into your individual risk of local recurrence, as does medications that we are taking to further reduce that. And we'll talk about that a little more specifically. So in addition to concerns about the local recurrence, we also are concerned about metastatic recurrence. And so what that means is that's also called a distant recurrence. So that means the cancers come back, but not in the area of the original cancer. And so for breast cancer, it's tissues of choice are bone, brain, liver, and lungs, okay? And so if we look at overall every single breast cancer survivor, the general overall risk is about 20 to 30% of those patients will ultimately go on to develop a distant recurrence. So the piece of this that's important to understand is in the United States, we do not the best job of tracking stage 4 recurrences, okay? So we do a really good job of tracking people who are initially diagnosed at stage 4, but we don't really have a national tracking system for people who end up with stage 4 recurrences. And so also in those statistics, because we don't track it very well, we also aren't necessarily potentially taking into account those medications that help to further reduce your rates for those HER2 positive patients as well as the hormone positive patients. So if you look a little bit more specifically, because again, we've talked about with local, all of those really specific traits of your cancer, the same is true for distant recurrence. So a large tumor size, 4 or more positive lymph nodes, we look at about a 40% distant recurrence rate for over a 15-year period post-diagnosis. And for a small tumor, low grade, no positive lymph nodes, we look at about a 10% over a 15-year, okay? So now that we have talked about all of those fun recurrence rates, let's talk about what we can do about those numbers, okay? So some of the things that you may already be doing are those hormone blocking medications that we've talked about. So those are the tamoxifens and the aromatase inhibitors. So tamoxifen is typically prescribed for premenopausal women who are hormone positive, meaning that their cancer is fueled by estrogen or progesterone. It can be used in postmenopausal women, but it's been shown to be less effective than the aromatase inhibitors. So if you look at 5 years of treatment, so 5 years of taking that medication, for the first 5 years, that will automatically reduce your recurrence rate by 50%. Then after you stop that medication, for the additional 5 years following, so from years 5 to 10, it's going to reduce your rate by 33%. So for aromatase inhibitors, this is our medication that's really designed for our postmenopausal women who are the hormone positive as well. And the standard of care is also those 5 years of treatment. So in that first 5 years, you can expect a 73% reduction in the recurrence rate and a 44% reduction in breast cancer related deaths. In the then subsequent 5 years, so now you're off the medication, for the 5 years following, you can expect a 37% reduction in recurrent rate and a 40% reduction in breast cancer related deaths. So as many of you may already know, the newest research is confirmed that 10 years is better than 5 years. And so there's discussion of now extending that. And what we don't know and what the ongoing research is if we look at everybody across the board, 10 years is definitely better, but we need to tease out who really is driving that gain. Are there certain subtypes of patients whose specific characteristics of their cancer really would benefit from those versus someone who may not have a benefit that will outweigh the side effects? So there is some new interesting research that I just kind of plunked in here for those of you who have made faces while I've been talking about extending the amount of time for you to be on that medication. There is some new research that says that if a person is on an aromatase inhibitor for 2 to 3 years, and then they switch to tamoxifen, which has fewer side effects in postmenopausal women, that they continue to have the same benefit as if they stayed on that aromatase inhibitor for the full 10 years. So that's the new research that we're trying to tease out exactly what we'll need to do in the future. Other ways you may be reducing your individual recurrent rate is targeted medications. This is the primary drug Herceptin. So this is for our patients who are HER2 positive types of breast cancer. The standard of care is 1 year of treatment, and a study came out just a couple of years ago that confirmed, fortunately for those patients, that 1 year is still all they need. So 2 years was not better than 1 year. So we're not looking at anticipating extending the treatment time for that. Those patients would automatically receive about a 46% reduction in their recurrent rates, and then a 33% reduction in their breast cancer related death. What we do know from research is Herceptin is best when provided with chemotherapy. And so those patients at 4-year follow-up who got chemotherapy alone, 33% of those patients had a recurrence compared to only 15% of those who combined the Herceptin with chemotherapy. And those who combined it also had a 33% reduction in breast cancer related deaths. So all of this is just to kind of tell you why that no two breast cancers are the same. And that when we talk about what your recurrence rate is, there's a lot more factors that go into that. So now on to the fun part of exercise. So a brand new study that's just come out and actually has just been published online and then will come out actually in its journal form in 2021. So this is fresh hot off the press. What they did in looking at research is they only included women who were at a high risk of recurrence. So what that means is these were the patients who already required chemotherapy. So meaning they already had positive lymph nodes, or they already had a type of cancer that we expected to be at a higher risk for recurring. So they then looked at these patients over an extended period of time, and they wanted to look to see what exercise did for them, okay? And so what they found is, and we'll go into the details in a minute, but basically what they said is, did you meet the ACSM guidelines? And we're gonna talk about that, but for now, did they exercise enough, okay? So the people who were exercising as much as the guidelines suggest prior to their diagnosis, and then we're still exercising, meeting those guidelines 2 years after their diagnosis, they had a 55% reduction in recurrent rates, and they had a 70% reduction in their death rates. These are huge numbers. So then the even more important part I hope for all of you to hear is, maybe I didn't exercise before, but now I've had cancer and here I am and I want to reduce my risk. That category of people, so people who did not meet the guidelines prior to diagnosis, but then at the 2-year follow-up were meeting the guidelines, they had a 54% reduction in recurrence rates, and they had a 57% reduction in death rates. So here's the interesting piece of this as well. So those numbers are based on them taking all of those patients. So again, I've said these are more high risk for recurrence patients in general, but even within that population, all of those individual characteristics still play out, okay? So what they did is they decided to take the data and they wanted to control for variables, because they wanted to say, regardless of your profile, what will exercise do for you? And what they found is when they controlled for the hormone receptor status, so whether you were positive or negative, when they controlled for your HER2 status, and when they controlled for the number of positive lymph nodes, they found that exercise did not give them any reduction in recurrence that they could promise for everyone. However, what they did find is that they were still able to tell people, regardless of those profiles, that they would have a substantial reduction in their death rates, okay? So what they found is people who did any amount of weekly exercise, but did not meet the guidelines, just did something, they moved, they walked, they did anything every week, 1 day a week, maybe for 10 minutes, they did something. When they compared to the people who did no exercise at all, those individuals had a 63% reduction in their death rates. If then you met the guidelines, so those people who then are actually meeting the guidelines, if they compared those to everybody, if you met the guidelines, you had a 60% reduction in your death rate overall. That is a huge number. So remember back to what we were talking about in the reduction for our medication, that's a bigger death reduction than we can achieve with medication. So then when they looked at the people who were exceeding the guidelines, meaning they got more than what we're going to talk about as recommended, there was almost a 70% reduction in death rates. And so this is really powerful news for all of us, meaning we can generally say if you have a less aggressive form of breast cancer that you're going to get a drastic reduction in your recurrence rate from exercise. But regardless of your type of cancer, it may come back, but your survival is substantially improved if you are exercising. So regardless of your type of cancer, there are massive benefits for starting to exercise. So why is exercise so fantastic? Why is it working? Why do we see these kind of benefits? Well, at first we talk about weight gain and obesity. So on average, breast cancer patients during their active treatment, and active includes the period that you are on Herceptin, you are on a hormone blocking medication, and so you may be done with what you feel like is maybe active, but if you're still on that medication for 10 years, we still consider you the active phase. So on average, women gained 5.5 pounds to 11 pounds, and it's not uncommon in the literature for there to be upward of 20-pound weight gain, okay? And this matters because weight gain and obesity is consistently linked to poorer prognosis for breast cancer patients. And so weight gain during your treatment of greater than 10% is linked to an increased risk of death. So for me, I'm 140 pounds. So if I gain more than 14 pounds, then I'm going to substantially increase my risk of breast cancer related death. We also know that obese patients, those are folks with BMIs of 30 or greater, have a 35% higher rate of breast cancer related deaths. And the unfortunate part about this is we also know that 65% of breast cancer survivors are overweight and obese. So this is a significant problem for our patients with breast cancer. And we really need to utilize exercise to reduce those risks, okay? And so why is that happening? Well, when there's excess fat, you have extra fat cells, and those fat cells are increasing the amount of circulating hormones because our fat cells actually produce the estrogen that we're trying to get rid of if you are an estrogen positive patient. And it also, fat cells increase our inflammatory markers. And so inflammation is bad for basically everything in our body, but it increases our risk for multiple types of cancer, as well as heart disease and many other things. And so that fat is really working against us. So the other piece of that is exercise is going to help prevent the risk of having metabolic syndrome or reversing metabolic syndrome. And so all that means is that you have 3 of the 5 characteristics. So abdominal obesity, that's what we generally call an apple body type as opposed to a pear body type. So that's that extra belly fat. You have hypertension or high blood pressure. You have low HDL levels, so you have low levels of that good cholesterol that we want. You have high levels of triglycerides, and you have high blood sugar, okay? Now, if you get back and you remember that slide where we had the 9 million things exercise does for you, exercise is gonna reduce our fat, so it's gonna help us to lose weight. It's gonna lower our blood pressure. It's gonna raise our good cholesterol. It's gonna lower our triglycerides, and it's gonna lower our blood sugar. So it helps to reduce all of those characteristics. And the reason that's so important is women that have metabolic syndrome who are breast cancer survivors are 2.5 times more likely to die as a result of their breast cancer. So exercise also helps reduce our risk of recurrence and our ultimate risk of death because it also improves our immune function and the surveillance of our immune system. So what that means is it helps those lymph nodes detect those cancer cells early and contain them. So it holds them in and it doesn't allow them to continue to spread. This is a little science nerdy, but this is one of my favorite things about exercise is muscle pumping. So when we exercise and our muscles are moving, they release something called myokines. Okay, so this is just a chemical signal that gets sent out into our body, and it goes around and it looks to find damaged cells and it gets rid of those damaged cells, and that's part of the process of exercising and getting stronger. But the benefit of that is it's also going around and attacking any damaged cell. And so, for example, cancer cells. So cancer cells are our normal cells that then the DNA gets off and we end up with a cancer cell. And so all of those fancy words basically mean that that chemical signaling that goes around causes our body to tell those cancer cells to kill themselves. So apoptosis, they get rid of themselves. They eat themselves. And so in general, basically it's signaling for our body to get rid of those cells, which then ultimately prevents the spread of those and the risk of recurrence, both locally and distant recurrence. Exercise, again, also helps us to repair with DNA. So it helps the prevention of that cell formation. The easiest way I think to explain this is think about skin cancer. So we know that the sun radiates on our skin and that damages the DNA, and then we end up with skin cancer. So all cancer in general gets back to DNA breakdown. So if we can improve our DNA repair, then we can reduce our risk of cancer. There's also some new research that's coming out in the mice world that then kind of what comes next is looking in people, but that aerobic exercise actually increases the blood flow to all of our cells, which then they make those tumors more sensitive to chemotherapy, which basically means the chemo might work better if you're actively exercising. The other important factor that goes into why exercise works is aromatase inhibitor noncompliance. I know several of you, and I know several of your side effects that you're having as a result of some of these medications. So the general non-compliance is about 25 to 40%. So it varies a bit in the literature, but suffice it to say, there are a lot of side effects that impair people's everyday life. What we also know is that obese patients are more likely to experience pain, joint pain specifically, that's significant enough to stop taking the aromatase inhibitor. So if we can exercise, if we can make that BMI come down so that we're not in the obese category, we're going to improve how much joint pain you're having. In addition, even if you're not in that category, exercise, like we talked about, reduces our pain level, improves our pain tolerance. And so all of those things then are going to mean we can keep you on that aromatase inhibitor. So exercise is helping you stay on the medicine that's also reducing your recurrence rates.
Carrie,
Yes.
a question came in, and let me get back to it. Sorry, give me just a second.
Yeah, unfortunately, I can't see the chat when I'm sharing my screen.
No, it's okay. It's okay. Is Evista a hormone blocking medication, and does it block estrogen? Like, does it block estrogen? Evista?
Evista, no. So our hormone blocking medications are tamoxifen, and then our 3 aromatase inhibitors, so exemestane, anastrozole, and letrozole.
Okay. Kay Jones, you can email me the question if there's more that you're inquiring. Just let us know.
Yeah, you can email and I will.
Okay.
On to you.
Thank you.
All right. So the exciting news about exercise. Okay. So this is just one of my most favorite little cartoons about Pilates over there. So exercise has few to no side effects. And like we've talked about, it has loads of extra benefits separate of whether you are in that lower risk of recurrence type of cancer, so that we then know that exercise will reduce your recurrent rate and it will reduce your risk of death. Or if you're in that higher, more aggressive type of cancer where we can't necessarily say it will reduce your recurrence rates, but it will absolutely reduce your risk of death. So regardless of that benefit, remember all those other general health benefits that you're going to get. Exercise can be done with little to no cost to you, and it's safe for cancer survivors. So there's excellent research that's come out now through Combined Oncology Task Force, and we actually work with Kristen Campbell. What they have confirmed is a message that's being sent out to all oncologists that every oncologist should prescribe exercise. And so one of the things they also discuss in this article is that it does not increase the risk of lymphedema if you do not have it, and it does not make it worse if you already do have it. So what is it that I'm telling you have to do? Okay, so we mentioned the guidelines. So what are the guidelines that you have to meet? Okay, so all you have to do is meet the ACSM guidelines. So that's the American College of Sports Medicine, and they've worked with several oncology task force. And what we need to do is meet 150 minutes per week of moderate intense exercise. What we know is vigorous intensity exercise, although that will give you lots of benefits. Moderate intensity actually is the best for reducing recurrence rates and reducing breast cancer related deaths. So what does that shake down to? That shakes down to 30 minutes 5 times per week, or 21.5 minutes 7 times a week. So a reasonable chunk of time that you can commit to, okay? So what does moderate mean? So the easiest way for you to be able to calculate your intensity is to track that by your heart rate. There are some other ways, and if you are a patient who has a medication that reduces your heart rate, so those are the beta blockers, we can certainly talk to you about better ways to calculate that. But the easiest way to calculate it is to estimate your maximum heart rate. And so that's just 220 minus your age, okay? And then based on that heart rate, we're gonna calculate a range that your heart rate needs to stay in, okay? So it depends on who you ask, the American Heart Association or the CDC, so whoever you prefer. I've always said 60 to 80, which falls a bit more in line with the CDC than the American Heart Association. But certainly if you're starting to exercise for the first time, I think 50% would certainly be enough for you to achieve moderate intensity. So then I did the math down there for you so you can see. So 220 minus 35, which is how old I am, is 185 is my estimated maximum heart rate. And then I would just multiply that times 0.64. So on this one, I used the CDC recommendation. So that gets me to 118. And then all the way up to that 76% is 141. So that means during my 30 minutes of exercise, I need to make sure that my heart rate stays between 118 and 141, okay? The other way to judge this during aerobic exercise is that you should notice that you're breathing a bit harder, but you should still be able to carry on a pretty comfortable conversation, okay? You are crossing over into vigorous land if you are huffing and puffing and can't comfortably carry on that conversation. The research also tells us that the best type of exercise are for us to get in 2 sessions of strength training and then 3 sessions of aerobic exercise. So making sure we're getting both strengthening and aerobic activities into them. So you could certainly do more of those if you are going to be the person that wants to do a little something all 7 days, but that's sort of the minimum recommendation. And so that's what we call in the physical therapy world the FIT prescription. So with every exercise that we prescribe, we want to tell you the frequency. So how often do you need to do it? The intensity, it needing to be moderate, the type. So for us, aerobic and strengthening. And so strengthening can be lifting weights, using resistance bands, using your own body weight. So for example, like a push-up is resistance training with just using your own body weight. You can use soup cans instead of weights. And then time. So again, that depends on your preference of how many times a week you want to exercise. So I put this slide in because I'm not going to advertise that I'd like you to go join a gym. So now's maybe not the right time for that. So ultimately being in gym is great. Joining group classes can be really motivating, but what can I do right now in the midst of a pandemic? Well, you can make an appointment with your wonderful Turning Point physical therapist, and we can design an exercise program specifically for you. So if you've arrived at a place where your function's good, but you just don't really know where to start with exercise, we can absolutely help you do that as well. And we can do that through tele-rehab. And so it doesn't require you to have to come in. We can do a Zoom call for that. We also have our workout Wednesdays. Mallory's going to kill me when she realizes I put this picture in, but this is a screenshot from one of her workout Wednesdays. So Mallory and Janae record generally from their home a video of them working out. Those are posted both on Facebook, and then Aurelis, I think, then puts them onto our YouTube channel. So that you can see them there. The nice part about that is there's a new one every Wednesday, but if you go to that YouTube channel, you can see all of them there. And so you can then pick which exercise series you like the best and then kind of use those as you're alternating. So there is aerobic components and there are strengthening components. And so that would kind of meet all of those pieces for you. There are hospital-based programs. I have heard from several of my patients that a lot of those have gone to virtual right now. So you can certainly look into the hospital that provided your care to find out what exercise classes they're offering remotely. Johns Hopkins also has a program that's called the Live Well After Breast Cancer, and they have a series of workout videos that are a little bit higher intensity if you are exercising some now, or you are maybe a regular exerciser but looking for something else to do. Getting outside is so good for you in general, and it is not 1,000,000 degrees anymore. So just taking a walk in your neighborhood likely will get your heart rate into that moderate intensity without too much brisk walking. In my neighborhood, I don't have to walk very fast at all because mine's hilly. So I get into that range pretty quickly. And I do recommend that if you're walking and you can't be walking with someone, you can just put in some earphones and chat with a friend. Having community and exercise generally motivates people and helps keep people on track. Amazon Prime also has a lot of videos. So if you have Amazon Prime, you can certainly look up some videos. I put in the particular one that I like. So all of those are available. So you don't have to get too creative to find ways to be exercising during the pandemic. And here are my slides of all the references, should you be interested in looking up any of those articles. And I will go ahead and take questions, I guess, right, Aurelis? I think before, yeah. Okay.
Yes, give me just a second. Let me just, I don't think I have any questions right now. Your mom did look up Evista is for osteoporosis, which AI can cause. It also says it's sometimes used to reduce the risk of invasive breast cancer in women who also have osteoporosis.
Got it. Perfect. Thanks, Mom.
Does anybody have any other questions?
I do.
Go ahead. It's okay. You're okay, Carrie. We just ask out loud at this point.
Absolutely. Let me get to my screen though where I can see everybody. How do I do that?
Or I can type it in.
No, go ahead.
And Purnima Patel, well, I'll send you the references. She asked if you could put up the screen again with the references.
Oh, I'm sorry. We can send that out.
Okay. We can definitely send it out. Thank you for asking, though. Sorry, Pat.
No, I was just going to ask, is there a type of exercise, I was just typing it in, that is not good to do right after you have surgery? In other words, are there any known kinds of exercise? Like my mom does a lot of arm tensing and such, and during her process, she had the lumpectomy. I kept saying to her, I can't imagine you should keep doing that, but she kept doing it because she said it didn't hurt. But I mean, it kind of was counterintuitive to everything I thought I had heard. So I guess to your point, everybody's different, but what have you found?
Okay, so it depends on how early we're talking. So generally with a lumpectomy, we've got a hold on exercise for 2 to 3 weeks. And then after that, she's good to go. So because lumpectomies typically have a smaller surgical incision. So what we're concerned about with the early onset of exercise is just protecting that incision and not putting tension where we might pop the edges of that incision apart. But as far as anything else, exercise.
And the other question I have is about the garments that you wear, like, you know, a sports bra or a special breast cancer bra. Is there anything that we recommend when you're in that phase of you're allowed to exercise that we recommend is better to really help you be comfortable and secure when you're exercising, or does it not matter?
So typically what I recommend are sports bras so that you have some compression there. Now, again, that's assuming that that surgical incision is well healed. So if we have a wound that's still healing, we don't want to compress it because then we compress out the blood flow, and we want blood flow for healing. But assuming everything is well healed, I have my patients wear a sports bra that has a wider band. So the cheaper and the uglier, the better. That's kind of what I tell people. Because I don't want really thin straps. I want it to be supportive and provide true support. And the band around the bottom typically is more comfortable for patients. So if it has a really thin band, it can hit right where the drain incisions are for people and can be really uncomfortable. And so if it's wider, it helps distribute that compression a little bit more, and people are generally more comfortable.
Hey, I have a question. That I had written in, but anyways.
Oh, I saw your question. So go ahead and ask it.
No, go ahead.
No, go ahead. So everybody knows you asked your question, and then I will answer it for everyone, and then I will answer it for you.
Okay. Well, you know, I'm a little different, a teeny bit, but anyway, you know, I've noticed lately because, you know, my arm got fixed by those surgeries so well. I mean, well enough that, you know, that doesn't bother me. But the second, the lymphedema of the breast, as you know, is not doing that well. So a lot of the exercises, and what I had written was, I'm not going to stop doing them, but it is painful. Is that okay?
So, yes, it is okay. So generally what we would recommend is that patients who experience swelling while they're exercising, so if that's in your arm or in your breast, you can wear compression while you exercise. Initially, we used to tell everybody you have to exercise in compression if you have lymphedema, and then we found out from the research that isn't necessarily true. But if you are experiencing more swelling, so for example, if you go for a walk and it's warm outside and my arms are dangling down by my side while I walk, my arms are going to swell whether I have lymphedema or not. And so if I also have lymphedema, I'm going to need to have my sleeve on while I'm exercising. And so what we would tell people is, to be in a compression bra and to be in a compression sleeve. Now you are in a little bit of a unique situation. And so what I would tell you is to loosen the notch on it. What I imagine is happening for you is it's ending up with too much compression because you're swelling a little. So I'm telling you the opposite thing, but that is not for everybody else. So
most everybody else.
The wide generalized answer to that is wear compression while you're exercising if you are experiencing swelling. Because although the research shows again that it's very safe to exercise, it doesn't increase your risk of developing lymphedema and it doesn't make it worse. Some patients do, while they're actively exercising, experience some swelling, just like I said, because of what activity you're doing can cause swelling in anybody.
Okay. Well, thank you. And I will loosen it a notch. And, you know, I'm still doing the 24/7 with the bra.
Right. So then just when you exercise,
loosen it. But I still haven't gotten back to where I was.
Yeah.
You know, I'm a few notches out.
Yeah.
But okay, I like tennis today.
Right.
I definitely, even though it wasn't hot out, it made a huge difference.
Right.
As far as pain. Mm-hmm. So I'll give that a try.
Yeah. Let me know.
Thank you.
You're welcome. Other questions?
No, well, I don't have any, but you did an excellent job, and I'll look some of this stuff up.
This is Brandy. I have a question.
Yeah, go ahead.
So when you're feeling like I had chemo Monday, and I work out regularly, but the first 2 days I'm really exhausted.
Yeah. Do
you figure out how to work out through it, or do you take the 2 days and just work out the other 5?
Take the 2 days.
Okay.
So, you need to allow your body to rest. And typically you will find that there's a cycle that you go through. So you've got the lousy days and then you go back up on the uphill climb. So allow yourself those 2 days to just take it off and then exercise the 5. Just allow your body that time.
Okay. Thank you.
You're welcome.
That was a great question. So, if nobody, I don't know, does anybody else have a question? Just as a reminder, this is going to be posted on our YouTube and Facebook channels, so you can go back and watch it, and we can send the references for those of you that would like the references. I'll make sure to send those out to everyone that's here. So, if there's no more. Going once.
Right.
Thank you so much. You did an excellent job as usual.
Absolutely. Thank you guys for coming. I enjoy teaching about exercise.
And I am a real person. I'm just in the bed. That's why
I'm a firm believer in the turning off your camera.
So, thank you guys.
Yeah.
Thank you.
Carrie, isn't it true too that even if you don't feel up to exercising like right during chemotherapy, you're talking about long-term benefits, right? The 5 years, the 10 years.
Absolutely.
Like, don't beat yourself up too much if you can't exercise as much or maybe at all.
Yes.
You just lie in the bed all the time when you're having chemo, but after that, then when you're feeling better.
Yes. Yeah. So we're definitely talking about the long term. So we want you exercising as a lifestyle change. But the research does show if you can exercise during those 5 days, you'll actually have fewer side effects and less during chemo if you can actually exercise during chemo. And keep in mind, exercise can be you got up and you walked down the street and you walked back and got back in the bed. So it doesn't have to be a massive amount of exercise, but if you are doing anything, it's going to reduce your symptom severity.
Okay. Thank you.
All right. Take care, guys. Thank you for coming.
Well, thank you.
Thank you so much.
Absolutely.
Thank you, everyone. We appreciate your support. We'll see you next time.
Okie doke.
Good job, Carrie.
Thanks.
Yep.
Goodbye, guys.